We are talking to Honorable Minister of Health in West Bengal, Dr. Surya Kanto Mishra. Dr. Mishra will brief us about investment opportunity in healthcare sector in West Bengal. Dr. Mishra, we have a lot of hospital owner and doctor who are willing to set up state-of-the-art hospital in different states in India, and of course they are willing to invest on this sector for health tourism and different purpose. So I would like to know what kind of public-private venture or what kind of fully private venture is available in West Bengal in this healthcare sector.
We have a public-private partnership policy that was previously available in our website, and we elicited response, reactions, views of all stakeholders before we finalize this policy. And that provides public-private partnership mostly in diagnostics now, starting from MRI, magnetic resonance imagery, CT scan, then laboratory diagnostics. But we have been trying also to have public-private partnership in providing healthcare in the form of hospitals. But what of late we are looking for is expansion of private sector, not only in and around Kolkata but in the districts, since the state government has to bear the responsibility of more than 70% of indoor admissions in the state. The private share in the indoor treatment is less than 30% in the state, whereas in the country as a whole, the government share has been around 40% and 60% goes to private hospitals. Therefore, the view that the government has taken is that the government will primarily devote for healthcare delivery to the people who can't afford to go to corporate hospitals or private hospitals. It's the responsibility of the government to provide poor people free healthcare. But at the same time, we want that private sector has a lot of scope for investment in the state. Already many corporate hospitals and other private hospitals have come to the state. Shankar Netrala is going to have the biggest eye care hospital, not only in the country but I believe in the subcontinent. Dr. Devi Sethi had been there in Kolkata and now expanding. Apollo Group of Hospital is already there. The Tatas are going for the state-of-art cancer treatment hospital, the best of its kind that the country would have now. So there are many others, and we would like many more to come and invest in this area, not only, as I said, in and around Kolkata, but outside the capital and the district also, because if there is a well spread out private sector and if it is competitive, the government would like to go for health insurance because health insurance requires the service providers in the private sector also. So there is also scope of a public-private partnership in that area. We have
Dr. Mishra, just I'd like to interrupt. Actually, this has been a lot of subject of discussion in our forum. Indeed, I talked to Dr. Anil Shah, who is one of the largest hospital owner in the United States, who is also our forum member. And he's been talking about the same topic of public-private relationship in bringing the affordable insurance to the common people, so that a large section of people can be brought under the Medicare for the government. So can you please elaborate on this topic? I think a lot of our forum members will be interested how they can contribute to their own country in bringing an affordable healthcare insurance to the people by public-private venture.
No, as I said, right now we don't have enough of providers in the districts, particularly in the rural areas. And besides government, and the government facilities are overloaded because they have to cater more than 70% of indoor admissions. So we would like private providers to come and join hand with the government in providing healthcare to the people that saves them from out-of-pocket expenditure and provide cashless service, and the government will pay for the premium, part of the premium, depending upon the income category of the person insured. And we have a national scheme for health insurance, and the state government wants to provide additional support in this scheme, provided private institutions that can fit into this design come up in the districts and also sub-districts level.
So, Dr. Mishra, coming back to the district town, I mean, you just rightly pointed out that most of the investments are coming state to